welcome back to Diabetes Eating and Wellness. You've entered our support modules for medications for diabetes. The first one is going to be led here by our favorite nurse practitioner and diabetes expert, Dana Stallings. Dana, take it away. Help us understand this drug class.
Yeah, sure. So we're looking at the Biguanide drug class, and everybody out there knows this as metformin. And so metformin is the generic name. As we go throughout these slides, we will look at both the generic name as well as the brand name, because many of you are on metformin, but some of you are also on glucophage, and it's important to understand that they're roughly the same thing. So metformin is actually the only medication that we have in the Biguanide drug class. And so glucophage and glucophage XR, that's extended release, are two of the other ways that we can fill this prescription. Riomet, Glumetza, Fortimet, these all come in different kind of capacities. Sometimes you can get it in a pill form, sometimes you can get it in a liquid form, because as you guys who take metformin are aware, metformin can tend to be a horse pill. So for some people, it's difficult to swallow. And so we can put you on Riomet in a liquid form, but it tastes terrible. So be prepared for that. The best thing about the Biguanide class is that it is inexpensive. It is not going to be one of our more expensive medications. This is generally on the $4 list at some of our larger pharmacies like Walmart or the CVS pharmacies within Target. Biguanides, or specifically metformin, works to reduce the amount of glucose that's being released from your liver. Oftentimes, a lot of patients think that we're only dealing with insulin and we're only getting glucose from the food that we're eating, and that's not true. So your pancreas is helping to control insulin, but your liver is also helping us to balance out your glucose levels by producing and helping us to level out your glucose levels, in addition to the carbohydrates that you're eating. In type 2 diabetes, our liver can get a little too excited and release too much glucose into the bloodstream, and that's going to drive up your overall glucose numbers and then eventually your hemoglobin A1C. So metformin helps us to tune that down without turning your liver off entirely. Your liver does more than just help us to manage your glucose levels, and we still want your liver to help us to manage those sugar levels, but we just don't always need the help that it's trying to give us. And so the metformin is also going to help our fat and our muscles to better utilize insulin. And this is important because we'll get into a little bit of an explanation of insulin resistance and how this kind of contributes to your overall glucose control as well. But by helping our body to better utilize glucose and insulin, which the metformin is helping us with, then we're going to keep our blood sugar levels more stable. The primary side effects of metformin are GI distress, otherwise known as diarrhea. So some people can have nausea, some people can just kind of have bubble gut, upset stomach, but in particular, when you start metformin, it can really throw you for a loop. You feel like every single time you take it, you are going to the bathroom. This should get better. And so your healthcare provider will start you at a lower dosage of metformin, generally 500 milligrams. And as your body and your stomach adjust to this new prescription, then we can slowly increase your dosage to make sure that your body is not only able to absorb the medication, but that you're also getting the full benefit of glucose control and you don't feel rotten all the time. Take this medication with food. My personal recommendation to my patients is to take it either in the middle of your meal or at the end of your meal, because you've already got that barrier of food on your stomach so that the metformin is not hitting it first and then you're headed straight to the bathroom. B12 supplementation is often recommended for folks taking metformin. This is actually a level that I monitor in my patients at least once a year. Not everyone needs a B12 supplement. So some folks do not absorb B12 well when they're taking metformin, but you can ask your healthcare provider to check your B12 level at least once a year. And if it's low, then you can just take an over-the-counter B12 supplement, just a vitamin that you get from your local drugstore. People with severe kidney issues, or doesn't even necessarily have to be severe, but anybody with kidney issues or heart failure should either reconsider taking this medication, should talk to your healthcare provider about it, or if you have a new diagnosis of kidney issues or heart failure, then get your healthcare provider on the phone. I do not recommend discontinuing your medications on your own, but certainly put a phone call into your healthcare provider and let them know that you have this new diagnosis and that they may need to take a look at your medications, just so that we don't make you, cause any new issues, make you any sicker. You see that lactic acidosis on your screen, and so lactic acid is something that can build up in your blood, and if your body, specifically your kidneys, cannot filter that through well enough, then it can build up and make you very sick. And so certainly, again, talk with your healthcare provider if you have any new diagnosis that you're concerned about.
Great information, Dana. Thank you so much. Okay, we'll see you at the next drug class.